But now let's bring you an interesting conversation that Chris had with some nurses or health workers on cervical cancer.
Welcome back, ladies and gentlemen. It's still Breakfast Daily right here, and we are about to have a conversation that will interest you, especially if you are a woman or you have a woman in your life. So it's Cervical Cancer Awareness Month, and this is a condition that affects so many women, and it's also one of the conditions or one of the cancers that can actually be, taken care of if it's discovered early. But we have some doctors here who are going to be taking us through this, and they are Dr. Nana A. Kunedu-Darko, who's a specialist family physician, and also the MWAG member, and also Dr. Anita M. Thibault, family physician at the Kolubu Polyclinic and at the Family Medicine Department, and also an MWAG member. Hi, ladies. How are you?
Fine, thank you.
All right. It's Cervical Cancer Awareness Month again, and we're here again to talk about cervical cancer. Like I said earlier, it's one of the cancers that actually can be prevented if seen early. You've taught us that so many times. But let's get straight into it. What is cervical cancer?
So cervical cancer is just a cancer of the cervix. So we have a dummy here of a woman's womb. If we were to take your womb out, it would look like this, and this is the tip of the womb. The womb is not this big actually, it's about this size.
Oh, this is how the womb looks like?
If you are not pregnant, the womb is actually this size.
So when you're pregnant, it starts expanding?
Then it starts expanding and expanding
so
to fit the
small
baby. It's small, it's like your fist.
Oh, okay.
So what happens is that this is like the vagina.
Yeah.
So the way that leads to the womb, but the mouth of the womb is called the cervix.
That's the opening.
That is the opening. It's not open usually, it's closed. It opens to let out the baby. It opens a little bit so you can bleed for menstruation, but it's usually not open. It's
what about
closed.
for sex?
No, it doesn't open for sex. It's closed. Yes. It's closed. So this is the tip, right? That's the mouth of the womb.
So that's the cervix.
Yes, so this is the cervix. If you look through your vagina, just like this, you can't see it. So you have to actually open it up with a device to see it in the hospital. All right, so this is one that looks, unwell. So a cervix, I have a good looking one. I'm not sure I do. Well, a cervix, a healthy cervix is supposed to be smooth, no bumps, no bleeding, no changes in texture or the way it looks. It shouldn't be painful. Yes, we have a speculum that we use to open it up, and then we can visualize it, we can look at it. Okay, so a normal cervix should look like this. When somebody has cervical cancer, that is when the cells in the cervix, the things that make up the cervix, have changed so that they are diseased. Diseased in a way that the cells, instead of going through their normal cycle, they live, they die, they have decided not to die, and they keep growing and growing and growing.
So is that what we call the lesions?
Yes, lesions can be cancer, they can be non-cancerous. Yes, there are different kinds of lesions. But cancer, today we are here to talk about cervical cancer. So we are talking about cancerous lesions, cervical cancer lesions. So really, to summarize, cervical cancer is just a cancer that is happening on your cervix. You can have cancer of any part of your body. Cervical cancer is cancer that is happening on the woman's cervix.
Right. Yeah. So how common is cervical cancer in Ghana?
So it's actually very common. So it's the cancer that's secondly most responsible for deaths in women.
Right.
Yes.
So
even breast cancer.
Right.
Yes. So after breast cancer, it's cervical cancer. And it's actually not as common in the Western world because they are able to detect it early. But over here, because we don't do a lot of screening, and the whole cervix vagina issue, people are very squeamish to talk about sex, to talk about their private parts.
Also open their legs for a gynecologist.
Exactly. And so it's quite difficult to get it checked out in Ghana. So it's responsible for it's the second most common cancer responsible for deaths in women.
Wow. Now, what is the link between HPV and cervical cancer?
So it's let's say it's a process. So HPV is a virus that has been determined to cause cervical cancer. And so for most cancers, you can't accurately say this is a cause. We usually talk about risk factors.
Right.
Yes, so things that increase your likelihood of getting the cancer. But with cervical cancer, HPV is a known cause of cervical cancer. Now there are different strains. There are different numbers. But 16 and 18 are the ones which are found to be the most common, the highest cause. Yes. So what happens is you initially get an infection, an HPV infection. If you have a strong immune system, you clear it just like a normal cold. Yes. But when you have persistent infection, so you keep getting infected, you are infected with different strains, or your immunity is low, then you can have a persistent HPV infection. And that leads to the precancerous lesions. And those precancerous lesions, if not taken care of, can go on to cause cervical cancer.
All right, so precancerous lesions are not the cancer yet.
No.
So it's just pre.
Yes.
So that means there's a possibility it can develop into a cancer.
Yes.
And that is why the screening is important.
That is why the screening is important.
And it's said that cervical cancer does not give you any signs or symptoms. So how...
So that's the scary part, that's the dangerous part. Most often when the cancer is forming, there are no symptoms. You won't feel anything, you won't know anything is happening. By the time symptoms show up, it means that there's some kind of lesion there.
Already.
That's why you are having symptoms, and that is why it's so important to get screened before you start having symptoms. Now the symptoms, like you said, no symptoms at all. That's what someone can be very fine and still have cervical cancer when you check, but some of the symptoms that one may have as the cancer advances is that you may have pain during sex. And mind you, these symptoms are not only for cervical cancer.
Yeah, they look similar to other things like
other
infections also.
Infections can give similar symptoms. So it's just that once you experience these symptoms, you should get to your care provider as soon as possible. So if you have pain when you have sex, during, after sex, you should get to see your healthcare provider. If you notice spotting or bleeding, after sex, you should also see your healthcare provider. If you notice spotting or bleeding that is in between periods, that's not really part of your period, you should see your healthcare provider. In fact, if you see any discharge, there are a whole lot
and different textures,
physiological normal discharge. But if you see any abnormal looking discharge, it would be good to go and see your health.
So when you say abnormal, what are they looking out for? Is it the amount? Is it the color? Is it the texture? What are we looking at?
So okay.
So I think you've basically described it. So as women, we should be able to tell when we have a normal discharge. So most of the time, normal discharge could be colorless or just a little whitish. It is not offensive, and it changes according to your menstrual cycle. It
does.
So there are times where it is thick and clumpy. There are times where it's stretchy. Yes. So you can have. So when you study yourself, you would realize which one is your normal. So the abnormal, the quantity changes. So it becomes copious. There are women who soak their panties and they have to actually use pads to contain the discharge. It's offensive. Yes. It's offensive.
Discharge
so, yes. It happens. The smell. So they have an offensive discharge. Then also the color can change. Okay, so yellow, green, blood stained, Anything that doesn't look like your normal is abnormal.
Right.
So those are the typical characteristics of the cervical cancer discharge.
Wow, wow, that's actually very scary. Now let's talk about screening. How does it work?
So I mentioned the process. So from the infection to the precancerous to the cancer. So it can actually take between 15 to 30 years to actually develop the cancer from the time you get the infection. So you
Please
have
say it again for those at the back.
so it can take 15 to 30 years to develop a cervical cancer from the infection. So you have a very long time to screen.
Oh, wow.
Exactly.
So that means you actually have time to be checking.
You have time to be checking. So it's very important that the screening is started. So typically we say most women from 30 years you should start screening. But if you are immunosuppressed for any reason, especially for those who have HIV, yes, they should start screening from 25 years.
Oh, right.
So when it comes to screening, we have different modalities. We have the VIA, which is a visual inspection with acetic acid.
Yeah.
So we open up your vagina, we look at your cervix, and we use vinegar to bathe it. If there are any changes there, we'll be able to see.
Yeah.
So that's visual inspection by acetic acid, and it's the cheapest screening modality we have currently. Then we also have the pap smear. So for the pap smear, we also do the pelvic exam. We take a little bit of tissue, but it is not like we are cutting out something.
It's a swab.
We use a spatula to swab around. We take the tissue to the lab and we check for any cancerous changes in your cells.
Yeah.
So that's the pap smear. Then we have the co-testing. So for the co-testing, it's just like the pap smear, except that we actually test for HPV DNA in the tissue that we collect. So we are able to tell which kind of HPV you have and whether it's one of the cancer causing ones. So those are the three main modalities that we use.
Right. So if a woman actually feels healthy, is it still important for her to screen?
Yes, it's very important for every woman to get screened, as she said. Screening is prevention. Screening helps us detect it early. Screening helps us save lives. So it's very important that if you're a woman out there, you've never screened or you haven't screened in a while. I know some of us, after we screened the first time and everything's fine,
okay,
so I'm fine.
I actually owe myself a screening.
So
about it.
it's important that you keep to the screening schedule. So for VIA, the more affordable one, you can screen, if it's normal, you can screen every 3 years, every 4 years.
That's the acetic, right?
Yes, the acetic acid. That's the guideline. For the pap smear as well, you can screen every 3 years. The HPV
so I think
DNA.
I'm fine. Yeah, I think my last one was that time. So
Within, so we are within.
I think I'm fine.
I'm sure there are quite a few people who are without. And then the HPV allows you the most time that you can do after 5 years because it looks at the DNA. One thing I'd like to talk about is what to do before you come for screening. Sometimes people think they have to clean up and do all kinds of things.
People clean up.
People do a lot of things before they come in. So timing, hygiene, and what to prepare, the information you would need to tell your care provider. One, timing, it shouldn't be when you are menstruating. So maybe about a week after you are done menstruating. It's the time is supposed to be 10 days after you start menstruating, but let's just say a week when you are done menstruating. That's more clear. A week after you are done menstruating, and you don't have to go in there and clean anything. You just have your normal wash outside. Don't put anything. Don't put soap. Don't put anything inside the vagina. You shouldn't douche. You shouldn't apply any vaginal creams, even tampons. I know some people use tampons for their menstruation. Again, that comes back to if you are menstruating, don't come for a pap smear. But don't put a tampon there to clear the place up, or discharge is there's normal discharge, so we know what
in
to
fact, we
expect
need a
when-
discharge.
Yes, when we go in there. So we've talked about timing, we've talked about hygiene, information that you should let the care provider know if you are pregnant or you plan to be pregnant, and when you had your last pap smear or your last cervical cancer screening, and what the results of that was, if you know it. And then relax. A lot of us are so, like she said, socioculturally going down your vagina, somebody opening your legs, looking through. You feel very exposed, you know. I wouldn't say it's painful, it's uncomfortable, and when you are anxious, it becomes more uncomfortable. Because when you are anxious, you squeeze all your pelvic muscles, and then you actually tighten the space up, which makes it more difficult to visualize the cervix. But when you relax, it's actually quite bearable. It's not unbearable. I think it's bearable. And it's important. If you compare the discomfort to the benefit of being screened for cervical cancer and preventing it, I think it far outweighs the discomfort that you might feel.
So but lastly, before you go, how important is it for us to take the vaccines?
So the vaccines are the first point of call if you are thinking about prevention. Yes. Currently, so good news is that we've actually rolled out a vaccination campaign. But the thing is, one of the risk factors for cervical cancer is early sexual debut. So the age at which a woman starts having sex is extremely important, because your sexual activity sort of drives how the risk of getting the HPV infection. So currently, the vaccine is available for free for ages 9 to 14 years. Girls. In the developed countries, they actually vaccinate men or boys as well. It's very important because boys also participate in sex, and they can pick the vaccine and then send it to their female sexual partners. So it's very important that boys also vaccinate. But our program in Ghana does not vaccinate boys. It's just girls. So after 14 years, then women, usually after 15 to 25 years, you can go and get the vaccine. Just that it's not on the program, so you would have to pay for it. The vaccine is available at the Kolebu Teaching Hospital Reproductive Health Unit. So if you are around there and you can afford it, you can go and get it. We have two different types of the vaccine. We have the 4, which has it's against 4 viruses. Then there's another one which is against 9 viruses.
And that one is more expensive.
That one is more expensive. And usually it's a 3-dose program. It's a 3-dose schedule. So you get the first dose, second dose, third dose. But our guidelines are have allowed for 1 or 2 doses. So if you get at least a dose, it is still protective. But the importance is that for girls who have not started having sex, the benefit is the best for them. So the 9 to 14 year group is the best for them. If you started having sex, or you are older than that age group, and you still take the vaccine, it doesn't mean you will not get screened. You still have to continue getting screened. So yes, if you can afford the vaccine, by all means go for it. But the screening is very important. Yes.
This is a very important conversation. I wish we can continue, but because of time constraint. But thank you so much. Thank you so much for bringing this to our attention, and I hope everyone watching right now adheres to it. Any final words?
Final words. We, as usual, at Medical Women's Association of Ghana, would like to thank Lexta, the makers of YAS, for sponsoring us to always give this advocacy every year. They've been helping us for so many years now to do most of our advocacy programs.
Thank you. Thank you so much. So we've been speaking to Dr. Nana A. Konedu-Darko, who's a specialist family physician and a member of MWAG, and also Dr. Anita M. Thibault, a family physician at the Kolebu Polyclinic Family Medicine Department, and also a member of the MWAG. Thank you so much. It's all about cervical cancer awareness, and please go get screened. It's important, and if you're screened before, go back again. You just have to keep on doing it. it again and again and again till we are all safe. Australia has done it. I believe Ghana can also do it. Thank you so much, and let's take a quick break and we'll be right back.